Hi class, how are you? This is Dr. Kim. I would like to go over two sets of CMS, pointing out important landmarks that you need to know for tomorrow's test. So let's just go over multiple radiographs. Hopefully this is helpful for you. So here we have bite-wing radiograph, obviously patient with lots of restoration and caries. I'll just point out anything that I just kind of see. Here's an example of cone cut, also along the edge of the fossa plate, that there is a artifact which is consistent with deterioration of the material or the degradation of the fossa plate itself. Let's go to the next one. Again, looking at this maxillary PA, the patient is biting on this bite block, but not all the way, such that these premolars are not touching this bite block. So this would be a case of where the fossa plate is not placed parallel to the occlusal plane. What else do we see? We can vaguely make out the floor of the maxillary sinus. Obviously this tooth, as well as this one, has a radiolucency which is consistent with apical periodontitis. Here we have a canine PA. This is the nasal aperture, and that's the floor of the maxillary sinus. A mandibular canine PA. Nothing in particular. This is the inferior cortex of the mandible, trabecular bone, bite wing. Let's see. Besides what we've already said, alveolar crest, there's not a lot of structures we can see. This would be an extraction socket of tooth number 32. You can see the outline of the lamina dura. Looks like we've already seen that radiograph before. So again, here's the maxillary sinus, and that is the nasal aperture. Nasal septum here, and that's the nasal aperture or floor of the nasal cavity, where they come together, and especially in this area it's a little more radiopaque, isn't it? So that's the anterior nasal spine. Occasionally we can see intermaxillary suture, but we have this kind of weird radio-opaque line which may represent, again, artifact or scratch on the plate, that it's almost masking the intermaxillary suture. One thing to note is there is this line, radio-opaque line, that everything above that line is a little bit more opaque, and below that line it's a little more radiolucent. That's the soft tissue of the nose. Maxillary sinus, or the floor of the maxillary sinus, we're starting to see most likely zygomatic process of maxilla and inferior border of the zygoma. And it's a little hard to differentiate which one's the zygomatic process of maxilla and zygoma, because we want to be able to see that U or J-shaped opacity. If I had to presume that this will extend something like that, such that this is a zygomatic process of maxilla, and then the posterior extent is the inferior portion of the zygoma, but we really do not have a good visualization of the area. External oblique ridge, very sclerotic change as a result of apical inflammation from this retained root tip. You can, I'm not sure how well this image quality is going to be, but you can see the superior cortication and inferior cortication of the mandibular canal. Again, the nasal aperture, and this is the floor of the maxillary sinus. Nasal aperture, floor of the maxillary sinus. This radiolucency is consistent with the lateral fossa. Here's the floor of the maxillary sinus, and this one is great because do you see this U-J-shaped opacity? This is the zygomatic process of maxilla, and then the rest of this opacity that's extending posteriorly represents a zygoma. So before the previous radiograph, we probably saw zygomatic process of maxilla and part of the inferior portion of the zygomatic bone. Let's see, so alveolar crest, and this area is so radio opaque. I think it's really difficult to tell what's what, but this oblique radio opaque line most likely represents internal oblique ridge. Mandibular periapical radiograph, inferior cortex of the mandible. You can see the cortication of the mandibular canal, and somewhere in this area we have mental foramen, but I think it's really hard to say where that's located. This increased radiolucency may suggest this is where it is, but I also see radiolucency that extends posteriorly, anteriorly, and extends up, such that this may also represent a mental foramen. We would really have to look at another view of this area to be more to have more confidence of the anatomic landmarks. But based on my experience, well, yeah, it could be this one, but I won't go into that too much more because 2D image is always a little limited. This opacity represents the genial tubercle, and this tiny little circular radiolucency within the center of the opacity represents the lingual foramen. But keep in mind that they don't always have to be in the center of the genial tubercle, but often they're very close to one another. Over here we can see inferior cortication of mandibular canal and then superior cortication of mandibular canal. This area is very radiolucent, consistent with the submandibular gland fossa or lingual undercut. Again, we can see this degradation of the fossa plate coating, European. Again, we have a cone cut. The etiology of cone cut is that this part of the fossa plate did not receive radiation as a result of the rectangular collimator. You can see this is nice and straight. And so if you again like the position of where this plate is positioned within the mouth, then we don't have to take I mean, you can keep it where it is if this was a sensor, and then you can simply move the cone more mesially to capture premolars. Oh, let me go back for a second. I think here we're seeing external oblique ridge. Yeah, again, mandibular canine periapical film, fossa plate image with inferior cortex of the mandible. Alrighty, that was it. Let's take a look at another set of images, CMS images. Here's the nasal aperture, here's the nasal septum, so that we can approximate that where they come together. This is the approximate area of anterior nasal spine. We can also see the soft tissue outline of the nose, and this radiolucency represents the nasopalatal foramen. And here's the lateral fossa, and over here you can see part of the intermaxillary suture. Again, floor of the maxillary sinus, which crosses with the nasal aperture. External oblique ridge. Here's a great example of lingual undercut or submandibular gland fossa. It's rather radiolucent, and this radio opacity, which essentially defines the superior border of the radiolucency, represents the mylohyoid ridge or internal oblique ridge. You can see a portion of the maxillary sinus, external oblique ridge. Again, floor of the maxillary sinus, nasal aperture. And this radiolucent area represents lateral fossa. We see maxillary sinus once again. External oblique ridge, this represents the internal oblique ridge. Here's the submandibular gland fossa, and it's likely that we're seeing part of the mandibular canal cortication. Again, internal oblique ridge, which defines the superior border of the lingual undercut or submandibular gland fossa. And again, within this submandibular gland fossa, you see a channel of radiolucency that's even more radiolucent, right? The darker than the surrounding undercut area. So that represents the pathway of the mandibular canal, meaning this most likely represents the superior cortication of the canal, and here probably is the inferior cortication of the canal. Okay, bite wing radiograph. Soft tissue of the nose. This area corresponds to the nasopalatine foramen, nasal septum, nasal aperture, and this approximately is the area of anterior nasal spine. Maxillary sinus. It has pneumatized quite a bit, very close to the alveolar crest. Here's a maxillary tuberosity. We're also seeing probably anterior coronoid process. I shouldn't say probably, this is the part of the coronoid process. And again, it's a little bit difficult to say this area and precisely know which one of these is the zygomatic process of maxilla and what is the part of the zygoma, but we do see that opacity, and it's one of those two structures that I mentioned. Again, that opacity. So this most likely represent again either zygomatic process of maxilla or inferior portion of the zygoma. But to know for sure, you need to see what I showed you earlier, where there was a clear distinction of that kind of U or J-shaped opacity. One thing that I want to point out is that this area is kind of it has that kind of stretched out appearance relative to the other one right here, and this is an example of bending, fossa plate bending, that I discussed before. You're not going to see this this type of error on sensor because obviously sensor would not bend, but this was quite frequently occurred on maxillary posterior PA. Floor of the maxillary sinus. Here's the nasal aperture and the maxillary sinus, floor of the maxillary sinus. Again, maxillary sinus, looks like there's a partial septation. And yet again, it's not clear, but we're looking at inferior portion of the zygoma or zygomatic process of maxilla. Having said that, zygomatic process of maxilla is typically located in the area of the first molar. So that's a good anatomic landmark to just kind of keep that in mind. Yes, it can appear, you know, slightly distal to first molar as well. As with any structure, you know, there's anatomic variation. So I would say that's the internal oblique ridge. So great visualization of submandibular gland fossa with the mandibular canal cortication. So that, to me, this is the internal oblique ridge, since that's the border of the submandibular gland fossa, but also here's the external oblique ridge. Again, nasal aperture and floor of the maxillary sinus. So here is, you know, if you want to be very, very precise, at some point here along the process, it's a floor, but then now this is more of an anterior wall of the maxillary sinus. Anterior wall, or you could also say this medial wall of the maxillary sinus, since it's right next to the nasal cavity. Right here, do you see this distinct small radiolucency? That's the lingual foramen, and just inferior to that, this opacity represents genial tubercle. Let's see a very important structure. Just keep that in mind. Trabecular bone pattern constantly change depending on the region of the mouth. Again, the trabecular patterns are much closer to one another in the upper half of this mandibular bone, and you can see marrow spaces are a lot larger in the inferior half, and that is very common and for most patients. And same thing here. So soft tissue of the nose, again, I hope you've seen this enough. Nasal aperture, nasal septum, and this is the area of anterior nasal spine. You can see the intermaxillary suture. And again, a very great example of submandibular gland fossa, internal oblique ridge. And this would be a kind of anterior aspect of the external oblique ridge. So that's all I have for you. Again, hope this was helpful, and best of luck. You're welcome to stop by my office anytime tomorrow when you're free. And otherwise, I'll see you tomorrow afternoon at 4 p.m. and be sure to sign the consent form and participate in research for the extra credit. Thank you very much, and take care.